right, I'm gonna get this right out of the way. It took me 7 hours yesterday to realize that Dr. Eftekari also took fat transfer from my inner thighs. Richard looked at my pants about 7 p.m. He's like, you got blood on your pants. And it was on the inside of my thigh. And I was like, what? What are you talking about? Like, did he take fat from my inner thighs too? So I went to the restroom and checked. And sure enough, there's 2 big holes on my inner thighs as well. I guess I just wasn't really paying attention. They didn't hurt until today. So my inner thighs really hurt today when I was taping them back up because the tape is all but come off. They look pretty tender and I hope that they heal okay. My outer ones are a little bit tender as well. But welcome to day 2 of my eyelid lift surgery or my blepharoplasty healing process. So today my throat, it's definitely tender from having the tube down my throat as it should be. She said it would feel like you have a sore throat. It kind of just feels like I have something in my throat, like a lot of phlegm. And that comes from my allergies. So that's bothering me. My thighs are bothering me. I'm much more swollen today, as you can see, more brown. So I'm definitely like just much more swollen around here. My back was hurting so bad from being flat on my back with my knees elevated on the operating table. My back hurt so bad and I needed to sleep in an inclined position last night. So we do have a platform where we can adjust it to 0 gravity. So I had it in 0 gravity, but I could just not get comfortable because that's where it hurts my back when I'm in the 0 gravity. You're actually not supposed to have any pain in the 0 gravity. So I tossed and turned for the longest time last night and I finally Richard wasn't sleeping well because I was tossing and turning so much. So I headed out to the living room to sleep on the couch. And that is the first night I've ever slept away from him since the day he moved in. So it was very odd, but I can't prop myself up on the back of the bed because it's wood and the couch I could. So I was able to get a couple of hours before I just decided I was just too uncomfortable and too awake to keep trying to pretend like I was asleep. So about 4 o'clock I got up and I finally took some kratom. I'd been taking Tylenol and ibuprofen alternating and those really didn't take any edge off. So the kratom helped a lot with my back pain. So that's finally gone. So hopefully tonight I'll be able to sleep much better. So last night we cleaned up the incisions on the top here. And as we were cleaning them up, Dr. Eftekari called to see how I was doing. I told him everything's fine. Like I don't have much pain besides my back. And I told him about that. So he just wanted to make sure that it wasn't muscular. I was like, yeah, it's definitely muscular. And then I did ask him how the fat grafting works. Is it like filler where it gets integrated into the tissue over time? And he said, yeah, that's pretty much what happens. Because I'm worried about this gap right here between the temple and my lower lid. This one I have just a tiny indent, but I'm thinking that it's probably the same when you get filler, like it just takes a while for it to integrate into the tissue. We did go to breakfast this morning because I was hungry. I mean, we had food here to cook. I just didn't feel like cooking. So the first thing I had to say to everybody was, well, I had to ask the server, the seater. I was like, can you please just put me in a corner where everybody's not gonna be staring at my face? Because I just had surgery yesterday. And then when the waitress came over, I'm like, don't worry, don't mind my face. I had surgery yesterday. She made a cute joke. She's like, oh, well, I don't have any makeup on. I probably look like death. So I was like, oh, you're cute. But so I did venture out into public today because it's really boring just sitting here doing nothing. I did talk to my son. I didn't think that he would FaceTime me. He's the one in Hawaii, and he did, so that was nice. At night, I do have to put the ointment in my eyes, so it is kind of painful, a pain in the butt to get out of my eyes just because they get so goopy that I can't see. My biggest concern when I scheduled this surgery that it was going to impact my dry eyes even more, and so far that hasn't been the case. The only time my vision has been blurred is when the ointment gets in my eyes. So the ointment will actually travel down from my top lid into my eye, so I'll have to like clean out my eyelashes. This morning I did get up and I combed out my eyelashes because they were just like matted down onto my upper eyelid. So they look a little bit better right now. Okay, and then yesterday I was so worried about getting that first video out that I wasn't icing my eyes as much as I need to be. So I'm supposed to be icing them for 15 minutes every hour. So my goal for today has been to just make sure that I am icing my eyes at the regular intervals. So far, I'm much better. I've only missed one icing session, and that's when we were at breakfast. So doing much better at the icing part, hoping to bring down some of the swelling. Really, that's all that the update that I have for today. I'm just bored, and the swelling is much worse, and I am worried about how my inner thighs look, because I can't really look down to see if the suture's there or not. It was just, I was rinsing off today. I put Saran wrap around my thighs, and then I just kind of like stood in the tub and like rinsed off with a rag, shaved my armpits, and got as clean as I could without getting my thighs wet. When I had my eyebrows microbladed, I would seriously Saran wrap around my head so I could cover up my eyebrows just so I could still shower. I didn't wash my hair. I had Richard wash my hair for me. But I'm always finding ingenious ways to use the Saran wrap after procedures like this. So I can shower tomorrow night. I'll probably just wait until Monday morning to shower. But that's really the update that I have for today. I'm in a bit more pain just because of the swelling. You can hear it in my throat. It's like a little hoarse from the breathing tube. And then I'm just going to go ahead and get in close up here. So looking worse on day 2 of the upper and lower blepharoplasty with fat transfer. I'll see you tomorrow.